I'll call the committee to order and ask the secretary to call the roll.
Ryan, Parker, Barnett, Blackwell, Blunt, DeBar, Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Parks, Polk, Tate, Turner Ford, Wiggins. We have a quorum.
I would say to the committee, as deadline day draws to an end, the session's going to go on for a long time. So if we've made any mistakes, we certainly have a pretty good chance of being able to correct them before the session ends. That doesn't necessarily mean we will. We'll have the chance to, but by the same token, if we've done anything right, we've still got time to undo that before the session ends. So it's a 9-inning game. This is not the 8th. I told the committee that when we reconvened, the first item would be Senate Bill 2922, which has been laid on the table subject to call. If anyone wishes to make a motion to take that bill from the table, we'll consider the motion. The committee can vote. If the motion passes, we'll consider the bill further. Senator Blackwell.
Thank you, Mr. Chairman. I make that motion.
Senator Blackwell moves that we take Senate Bill 2922 from the table. Is there discussion? Are you ready to vote? All in favor say aye.
Aye.
All opposed, no.
No.
Let's try again. All in favor, aye.
Aye.
All opposed, no.
No.
It appears to me the noes have it.
Division.
The division's requested. All in favor of taking the bill from the table, please raise your hand. I'll ask the secretary to count. Okay. All opposed. Is the vote. It appears the motion has prevailed. So that bill is now before us, and Senator Blackwell, I believe, title sufficient due pass was the matter that was pending. I think you're recognized to make motions, debate the bill, whatever.
Thank you, Mr. Chairman. I want to make sure as we went through the other day, I had offered a couple of amendments, and I'm not sure if council caught those, so I want to make them more formally. And I also believe Senator Fillingane has an amendment he would like to offer as well. So my first one is on lines 1285 through 1289. That text should have been stricken. It says a resident card holder shall not obtain more than a total of 6 MMCEUs of allowable medical cannabis in a week from a dispensary or a combination of dispensaries. And the reason that's no longer valid is we've changed possession up to a month.
Senator Blackwell, if you could talk more directly into the microphone, it's the usual situation.
Well, I'm finished. That was an explanation of the amendment.
You offered an amendment there?
I will restate the amendment.
Okay.
On lines 1285 through 1289, striking the text that says a resident card holder shall not obtain more than a total of 6 MMCEUs of allowable medical cannabis in a week from a dispensary or a combination of dispensaries. And the reason being is we are allowing moving to a monthly allotment versus the week.
Point of order.
Senator McMahon? I'm not I'm not sure. Are you saying you don't have a copy of the bill?
We have a bill, but that's not those lines.
You're saying those lines are not in the bill?
I'm operating off the strike text version. Council tells me it starts on 1273.
Is just as a technical matter, is the amendment technically correct? So, Senator McMahon, have you got a bill with these line numbers on it?
Is this the bill before us, the bill with the amendments from the other that were already made the other day? Is this the original bill? What line?
1275.
I mean, my understanding is that what happened is we called up the bill. Senator Blackwell offered some amendments, which I believe were adopted. And then it appeared that debate was going to go on for some time. So we laid the bill on the table, subject call. We've now taken the bill off the table. We're right back where we were. Senator Blackwell has offered an amendment. And the question is there debate on the amendment, Senator Harkins?
Can he restate the amendment now that we got the right line to see what we're?
Yes, it's deleting a resident cardholder shall not obtain more than a total of 6 MMCEUs of allowable medical cannabis in a week from a dispensary or a combination of dispensaries.
So you're deleting that?
Yes.
Okay.
Senator Hill.
So my understanding is if you delete that language, they can get as much as they want?
No,
No?
we are going to a monthly a purchase allotment versus weekly.
Thank you.
Anyone else? Debate?
Question.
Senator McMahon?
So what we're deleting is 6 units a week.
We're
So that would have been 24 units a month, and we're changing it to 30 units a month. So we're increasing that, or from 24 a month to 30 a month. So we are increasing it
yes,
if the amendment, with the amendment.
correct.
Further debate? Ready to vote? All in favor say aye.
Aye.
Opposed, no.
No.
It appears the noes have it. The noes have it. Senator Blackwell. Are there other amendments?
Yes, I have one more. I have, I'm not sure, since I'm going off the strike all version, that the lines line up, but in the text of the bill, we talk about certification. It'd be on lines 1123. So it would read we're going to have GMP certification by July 1st of 2027. And what this amendment states that the certification must be from a nationally recognized entity.
Have we got the amendment correct and the lines and everything? Okay. Is there, do you want to speak on behalf of the amendment, or is there?
I think it's self-explanatory.
Okay. Questions, debate? Senator Hill?
Forgive me, but what is the GMP, nationally accredited agency?
It is a certification that food processors go through to ensure quality.
So are we still having our state testing facilities as well? Are we turning it over to a national agency?
No, it would still have the state testing.
Are you ready to vote? You understand the amendment? If you're all in favor of the amendment, say aye.
Aye.
Opposed, no. It appears the ayes have it. Here's the ayes have it. Senator Blackwell.
That's it for mine. I believe Senator Fillingane has one that he'd like to offer.
Senator Fillingane.
Thank you. Yeah, I did it. Thanks. Thank you, Mr. Chairman, and Chairman Blackwell. My amendment deals with the advertising section. So if you'll flip over to lines 1484 of the bill. My amendment would amend on line 1484 by striking the word broadcast, and then amend further on down line 1484 by striking the following words: or through mass messaging or email communications. And then further on line 1484 by inserting the word unsolicited before the word electronic. So basically, this amendment, if you change all that and reread starting on line 1483, it would state standards may restrict but not prohibit advertising and marketing through unsolicited electronic or print media, and provided further that the standards may not, and continue on. And by way of explanation, I feel like the way that the current wording was way too broad on how you could advertise for the medical marijuana. And my concern is the targeting of minors or, underage folks through these means of advertisement. So I understand the argument that if you're going to be, a legal recognized business, you need to be able to advertise in some ways to get the message out about your product. But at the same time, I feel like we have an obligation to make sure that minors who are not even allowed to use the product need to be shielded in some ways from this type of advertising. So that's my proposed amendment. I'll be happy to answer any questions.
There debate or question, Senator Hickman?
Senator Fillingane, just so I can get an understanding of your amendment, it would still leave open, say if a customer who is of the dispensary signs up to get like text messages or emails or things of that nature, it would have still allowed them to communicate with those individuals.
Yes, sir.
But the only way they could send out mass messages or anything is if it's in a way solicited in some type of way. So it requires someone to sign up to get messaging from a dispensary or what have you.
Sure, you can, obviously, if you're a customer, just like any other business, and you go in, you say, hey, I really like the latte of the day at my local coffee shop. I want to sign up to get your daily specials. I know I have a constituent who has a lovely coffee shop in Summerall, the Daily Dose. Please feel free to swing by if you're in the area. And they have daily specials on, their soup of the day or their latte of the day, whatever it is. I mean, if you want to sign up for the latest special on the cannabis product, I have no problem with that whatsoever. But I don't think there should be mass emails going out to all persons, including underage persons, saying, please come in and check out our latest crop of cannabis we have in stock today. So that's what I'm trying to avoid.
Okay, and just for an understanding, I guess in the plain reading, I was trying to catch you and write in the things you were saying.
Yes, sir.
But it basically changes what we already have to basically saying if you're going to be sending out mass things or whatever, it has to in some way, this person needs to have signed up for it in some type.
Sure.
Thank you.
Yes, sir.
Anyone else? Ready to, Senator Polk.
Thank you, Mr. Chairman. Senator Fillingane,
Yes, sir.
you talked about the special of the day.
Mhm.
This is medical marijuana.
Right.
Are they having specials of the day at their dispensaries?
You know, I've not darkened the door of a dispensary, in all honesty with you. Although I've worked with some on the business side, trying to get them set up to, open up. But I do believe that they do have different strains and blends, I think they call them, where it's sort of a customized product that they put together in their places of business. And so, yes, I do think there would be specials, special not meaning maybe a discounted price special, but a special, a new variety that we have now grown and mixed and genetically altered that provides, help for sleep or help for this or that. So yeah, I think there are different specials in the sense of new strains, new blends, new compositions of the product.
What they're gonna think of next? Thank you.
Further debate? Senator Fillinger, do you want to close?
No, Your Honor, I would rest at this point and move adoption of the amendment.
You're going to refer to me as Your Honor. I'm going to go sit up there on the top row. You understand the amendment? Ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Further amendments? Senator Parker.
Thank you, Mr. Chairman. I have an amendment, and my amendment picks up with, I think, some discussion we had in the last one concerning the use of telemedicine for recertification. Although I believe homebound is maybe an appropriate definition to have in here, I have the concern that the recertification via telemedicine could lead to maybe some outside the state providers providing this service instead of our qualified doctors and nurses and practitioners within the state. And so my amendment would be to strike lines 390 through 397. And subsequently also strike the only other two lines I see that kind of qualify to that are lines 451 and 452 in the underlined text only right there. So the intent would be to give more thought to the concept of telemedicine as this moves forward. I'm not sure what effect that would have. I do have concerns after meeting with the Board of Medical Licensure in appropriations that there could be some unintended consequences that could develop as a result of this provision in the bill. So I'd be glad to yield for any questions on the amendment.
You got the amendment?
I think homebound will be fine, and I saw later in the bill that there was a provision that would allow delivery to an appropriate facility. I think that would be okay. It's just the telemedicine provision. So my amendment would only be striking subsection 00, 390 through, and I'm not sure if everybody's on the same copy. I'm on the one I'm on here, 390 through 397, and then again in 451 through 452.
Well, I'm somewhat confused about how it is that we all don't have the same copy of the bill. I mean, it looks to me like we've got 2922 is introduced.
Mr. Chairman, I'm sorry if I missed what you were saying there. Was being provided with.
Well, I just said, don't we all have Senate Bill 2922 as introduced in front of us? I mean, I think some of the amendments may have been referring to the wrong lines, but I think.
For clarification, I was trying to make sure that Chairman Blackwell was able to find the lines, because I think he may be looking off of a different copy, Mr. Chairman. But as a clarification to the amendment, council did mention to me as well that on line 425, there is another reference to telemedicine. And so my amendment would be further that patients who are homebound can receive delivery of the product and then strike the assess through a telemedicine appointment. I think that catches all of the telemedicine reference according to council.
Have you got the amendment? Do y'all understand the amendment? Is there debate on the amendment? Senator Turner.
Thank you, Mr. Chairman. So if the person is homebound, meaning they cannot leave their homes, how would they be evaluated to receive a prescription if this amendment is adopted?
So what I do in my practice is I go to their home, and so I know in this particular industry, I think there are probably some people who would be able to make those arrangements and deliver that. I don't see this as a large number of the recipients, and so I think, there will be some provisions that can be made by the providers in this situation to meet that need.
Thank you. What about people in hospice?
And
Same
my
principle?
same answer applies.
Thank you.
Further debate? Ready to vote? All in favor, say aye.
Aye.
Opposed, no. It appears the ayes have it. The ayes have it. Further debate or discussion? Senator Fillingham.
Thank you, Mr. Chairman. Sorry to belabor the point. I was just curious. I'm looking at the lines 222 and 223. It's my recollection that the underlying portion of that sentence was taken out earlier when we first took up the bill, but I see it still here. So maybe that's because it was laid on the table and then brought off the table. I just want to get clarification as to whether that language, the or any other medical condition as certified by a practitioner, is still in the bill as it is before us to be voted upon or not.
Anything else?
Answer to that question yet. So I'm not sure, maybe if I could ask legal counsel, is that language on line 222 and 223 still presently before us, or is it gone? I can't hear you, I'm sorry.
Please speak into the microphones. We simply can't hear otherwise.
Thank you, Mr. Chairman, and I apologize. So you all passed that amendment before we laid the bill on the table. So when you passed it, of course, we took that language out. And now that we brought the bill back up, that language is still out to clarify.
Thank you.
Senator McMahon.
Mr. Chairman, thank you. I understand there's some moratorium language in this bill that will not allow for additional permits to be issued, whether that be for retailers or for growers. I'd like to identify where that language is and discuss it.
Senator Blackwell.
Yes, Mr. Chairman, it is in the bill. I couldn't point to it right now.
I understand there's language in here that, the people voted on a bill. The people voted on legislation 2 years ago. They wanted a robust medical cannabis program with open access where anybody could access the program. We're a year into the program, and now there's language to restrict those that can have permits. And that's not very free market. And I'd like to identify that and remove that language if the committee would be willing to work with me on it.
Well, it would be possible simply to remove any language that imposed a moratorium, and as we generally do, we let
Okay,
council find the appropriate language in preparing the committee sub. If there's not any objection, let's just take up that
So-
amendment that would remove any language in this bill which imposes a moratorium.
yes,
Is that
sir.
right?
Yes, sir. Thank you, Mr.
Okay.
Chairman.
Senator Blackwell.
Thank you, Mr. Chairman. You know, it's kind of interesting. I'm sitting here and you talk about the people voted for a robust program. All we've been doing and you've been voting, let's kill the program.
No, the program that we passed on the floor last year, Senator Blackwell, is in effect. And it's a program that you said in here the other day that was working. It's been highly successful. It's been called a model for the rest of the country. And now we're bringing major changes, 12 months, 15 months, 18 months into this program. These are major changes. And I don't want to restrict those that want to go into the business. I don't think we should be restricting it for those that go into the business because that was a major component of what we passed last year.
Yeah, but you're restricting, this is a highly regulated industry. We've got restriction after restriction after restriction. We come and we present options to grow the program, they're shot down. You just yourself shot down one of the proponents. It's only for.
I did vote to limit the amount.
Yeah.
You were trying to increase the amount.
It's only for a year to give these people a chance to catch up. And then it goes back to normal. Because I too, was against, everybody wanted a free market. We gave them a free market, but we're over-regulating them. So these people have spent millions of dollars.
I understand.
Anticipating that as we go through this, we'll have changes. We're going to make changes. Every year we're down here, we make changes to bills.
Yes, sir. I still support the amendment though, to remove any moratoriums because there may be other companies that want to get into this business. And by limiting or creating a moratorium, we're creating a situation where some companies will never be able to catch up because they'll already be so much further ahead. They will not be able to enter the market.
I don't think a year moratorium is going to create that kind of hurdle for folks. And it protects the folks that came in at the very beginning. So, and I would oppose the amendment.
So I would like to discuss the amendment. This bill will restrict, it will create moratoriums on people that want to invest in this industry, that would like to enter this industry. There are those that have already invested millions. There are those who are in the process of investing millions, who have applications before our agencies. And they've not been awarded those yet. And if we pass this bill, then there will be moratoriums on those and they will not be able to receive those permits. So I would like the conceptual amendment to remove all moratorium language from the bill. I ask you to support the bill.
That's the moratorium on issuing licenses. So under
Any license.
Under your amendment, there would be no moratorium on issuing licenses, and whatever the existing law is, it would still be that way.
That's correct.
Further debate? Senator Blackwell?
Thank you, Mr. Chairman. I still oppose the bill. This is a one-year moratorium. It's to give the folks an opportunity to catch up. We had an issue, as some of you may or may not know, with a lab that was a bad actor, and that put a pause basically on all the products going to dispensaries. So there's excess inventory. This just gives these folks the time to be able to get rid of their inventory.
You understand the amendment? Are you ready to vote on the amendment? All in favor of Senator McMahon's amendment, say aye.
Aye.
All opposed, no. It appears the noes have it. All in favor, raise your hand. All opposed? I'm told a vote of 4-7, the noes have it. Further debate on the bill?
I would, Mr. Chairman, if you'll recognize me.
Senator McMahon.
I would like to ask the committee to turn their attentions to lines 1389 through 1407. It's been discussed here today that we want to make it easier for people to do business and not make it more difficult for people to do business. So I see here some language that's going to require individuals with a work permit to go through educational hours. But not only do they have to go through educational hours, we're going to empower a bureaucracy, 2 different agencies, to promulgate and approve a quote, responsible vendor list. I would like for someone to explain to me what a responsible vendor list is.
Senator Hill.
Senator McMahon, I probably can't explain it to you, but in my thinking, if they're not a responsible vendor, they shouldn't have a license. Would you agree?
Well, I'm concerned, Senator Hill, that, we've got 2 different agencies that are going to promulgate rules together for a responsible vendor. And then once they issue a work permit, then the employee has to go and have their work permit is temporary until they go and get some educational training hours, adding another layer of bureaucracy to, and I'm sure every one of you at this table have been hearing from the private sector about how difficult it is for people to get their cards, how difficult it is for the companies to get their permitting in a timely manner. They've got millions of dollars in the ground or in buildings or in structures, and then they're unable to get their licensing. And now we're creating even more bureaucracy by asking 2 agencies to create a responsible vendor list and then having a permit issued. And then that permit being issued is a requirement of whether or not you go and get 8 hours of education. What is that going to cost? How much is 8 hours of education? What's it going to cost?
Thank you, Mr.
Do you want to
Chairman.
respond?
Sure.
Senator Blackwell.
Senator McMahon, we have had in the original bill training requirements, educational requirements for all the workers, because it is a new industry. We wanted to make sure that they were knowledgeable about the cannabis industry. There was a concern that some of these folks were getting trained at the workplace or going online and getting any kind of education hours done. So what this does is it is going to require that the Department of Health and the Department of Revenue finding a list of quality, I guess, vendors, if you would, or websites in which these people could go to get their approved education before they get a permanent work permit. And I would think we'd want all these folks trained as much as possible.
Any more debate on the amendment?
Well, I'm just asking. I was
okay.
asking about.
We don't have an amendment.
I don't have an amendment at this time, but I think this is creating more levels of bureaucracy. It's empowering the bureaucracy to create more levels of bureaucracy in permitting your issue. If you may be employed by a company, and then your permit may be rejected if you don't get your 8 hours of training. So I'm just trying to, and nobody can tell me how much the training is going to cost.
But I misspoke. You don't wish to offer an amendment to remove the language.
Well, if I felt more comfortable about it, Mr. Chairman, I was hoping some of those questions could be answered. So I guess I am going to put it in a form of an amendment, and this will be an industry-friendly amendment. I would like to strike 1389 where it begins with MDOH and MDOR, strike everything underlined through lines 1408.
So you'd strike the underlined language on page 56.
I would, on the bill I have, that is correct.
I sure think we all have the same copy of the bill.
Guys, this is an industry-friendly amendment because.
You understand the amendment? Is there debate on the amendment, Senator Blackwell?
Thank you, Mr. Chairman. This is not, your amendment is not an industry-friendly amendment. It's just the opposite. And I would oppose the amendment.
Further debate? Are you ready to vote? All in favor, say aye.
Aye.
All opposed, no. It appears the noes have it. The noes have it. Further debate? Amendments? Not, are you, Senator Blackwell, you have anything else? So I suppose that we need a motion title sufficient to pass committee substitute.
Yes, sir.
Do you
That'd be my
understand the
motion.
motion title sufficient to pass committee sub? Is there debate? Senator Hill?
Just wanted to make the comment and not offer an amendment, but that when the cities and counties had the opportunity to whether to stay in or opt out, they may or may not have anticipated all these changes that are being made to the program. So I do have concern that it's going to cause heartburn amongst some of these people that voted or didn't opt out of the program with the changes and the increase in the amounts and things. So I would just ask that the committee keep this in mind, that they now have a wild card. Whatever the legislature decides to throw at them, they have no opportunity to opt out now. So they have to tolerate whatever we give them. And, you know, we all want local control, we say, but I don't think this is fair to the people that went through that time to opt out of the program and maybe thought the program was okay and didn't opt out. And now that we're, you know, doing everything to open it up, I think that we're putting those folks in jeopardy of their vote and what their constituents may or may not be willing to support. That's all.
Further debate? Motion's title sufficient to pass committee substitute. All in favor say aye. All opposed, no.
No.
It appears the noes have it. The division's been requested. All in favor of title sufficient to pass committee sub, raise your hands. Okay. All opposed? Okay. The vote is 7-7. On a tie vote, the motion fails. The next item on the agenda is Senate Bill 2156, Mississippi Rare Disease Advisory Council created UMMC. I'm under the understand that the University Medical Center does not oppose the bill. There's a desire to look into particular rare diseases. There's been some success in doing this, and it would make a more formal situation at the medical school. That's what the bill does. Is there further debate, question, motion? Motion title sufficient to pass. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2159, Marriage and Family Therapist. Senator Fillingane, was this in your subcommittee?
Yes,
Okay.
yes, Mr. Chairman, it is. I will go to 2159. And essentially what this one is doing, it adds a second national accrediting entity for degree programs. The original one is this very long acronym, COAMFTE, and that stands for the Commission on Accreditation for Marriage and Family Therapy Education. That's the original one. And then it adds to that an additional accreditation, I think on lines 23 through 27 for CACREP, which is the Council for Accreditation of Counseling and Related Educational Programs. The purpose of this is to line up our family and marriage therapists along with those that belong to these nationally recognized entities and groups, so that it sort of standardizes people being able to come here to work in this field and then have reciprocating authority to go to these other states that recognize these groups. So that's what it essentially is for and what it does. I'll be happy to attempt to answer any questions.
Debate, discussion. The motion is title sufficient to pass. All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2714 is a bill requested by the Child Protection Services. There is a federal program for qualified residential treatment programs, which are opportunity for placing some children who are in the department's within the department's jurisdiction. They would like to have this option, and what this bill does is give them that option. There's a motion, title sufficient, do pass. Debate. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Let's go to Senate Bill 2871. Senator Fillingane. I think that was in your subcommittee.
Thank you. 2871. This one deals with, and let me flip to it. I think this is Senator Suber's bill, so if he's here, I would certainly defer to him, but it addresses the age discrepancy in the Mississippi Juvenile Tobacco Access Prevention Act, and the Attorney General's office is sort of working in conjunction here. What they tell me is that currently there are sections that apply and speak to persons being 21 or older. And then there are other code sections also related to tobacco access prevention that reference 18 years of age. So for instance, currently section 9732.5 provides that it shall be unlawful for any person or retailer to sell, barter, deliver, or give tobacco to any individual under 18 years of age, unless the individual under 18 years of age holds a retailer's license to sell tobacco. However, section 9732.9 and other code sections of the Mississippi Juvenile Tobacco Access Prevention Act provide that no person under 21 years of age shall purchase any tobacco product or alternative nicotine product. So the act contains inconsistencies in the language and presents enforcement problems for those entities like the Attorney General's office who attempt to regulate the sale of tobacco to those that are underage. So specifically, this bill addresses age discrepancies by clarifying that it is unlawful for any person or retailer to sell, barter, deliver, or give tobacco products to any individual under 21 years of age unless that individual holds a retailer's license. That is what the bill, I'm told, attempts to do.
Is there further debate or discussion on the bill? You ready to vote? All in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2873, Senator Turner Rosetchers.
Senate Bill 2873 creates uniformity among hospitals, dental offices, and physicians for the retention of records. For medical records, they should be maintained for 10 years, and then for graphic matter, images, and x-rays, they should be maintained for 3 years. And that is what the bill does.
Questions? Senator Hill.
Mr. Chairman, I have an amendment.
Would you like to tell us what it is?
Yes, I would. It's become known to legislators that we have hospitals in our state that are withholding medical records from parents of minor children unless and until the unemancipated minor gives consent for the parent to see the records. Actually did a peer memo and got that confirmed. I had some parents contact me that were locked out of their kids' MyCharts when they turned 12. And then that became public, and our flagship medical center raised that to 14. I've spoken to both sides of the aisle on this, and both sides of the aisle, the people I poll think that parents should have access to their children's medical records without their permission. And so my amendment would state on line 11 that hospital records in their original microfilmed or similarly reproduced form shall be provided upon request to a parent or guardian of an unemancipated minor under 18 without the permission of the unemancipated minor.
And where did you have a particular place in the bill?
Yes, after the period on line 11.
Right.
You could do a new section and do it for B, and then that would make the line 12 C. So it would actually be B, and it could start on line 12.
So you understand the amendment? Debate, Senator Wiggins.
Thank you, Senator. I'm just curious, if that's happening, which sounds like it is, what are the reasons? Because you're a minor as a minor. So what basis do the hospitals have for denying the patients the paperwork?
In the peer memo, UMMC stated that they tried to coordinate the age with the onset of puberty, and that they felt like the child should have privacy. And they also stated that there was a code section that said a person in Mississippi could be treated for pregnancy or childbirth without parental consent. Although I feel like that doesn't really have anything to do with records.
I guess, and maybe you don't have the answer to this, on what legal basis are they standing in that being said?
Because they say they can do it. And nobody stopped them.
Well, again, doesn't sound, my question is what legal basis, but if they haven't stated that, then we don't know.
They just referenced those code sections and gave the onset of puberty as their reasoning.
Senator Parker.
Thank you, Mr. President. As the author of the bill that we have in front of us, let me state also that the situation Senator Hill is mentioning has been brought to my attention as well. And I do think that, parents should have that say in the disclosure, and they should know what's going on in their children's medical life. And with that being said, I would consider this as a friendly amendment to the bill as I authored. And yield for any questions if anyone has a question about me, about my concerns as related to the amendment.
I have a
Senator
question.
DeBar.
Thank you, Mr. Chairman. And I don't know the answer, Senator Hill. Does this, if we put this amendment is approved, would it violate HIPAA under the federal law? I don't know the answer.
Not according to the memo. They said it had nothing to do with HIPAA.
Okay, so it was another reason besides HIPAA.
Yes,
Okay.
because they chose to do it and for the reasons that I stated. And I have a copy of the memo on my desk if you'd like to see it.
Okay, thank you, Senator Hill. Thank you, Mr. Chairman.
Senator Turner.
Thank you, Mr. Chairman. Is the amendment just limited to hospital records, or would you want to propose the same for the dental and the physician's records?
Section A is for hospital records. And if you want to include physician records, which I think is a good idea, you can flip back to section lines 146, where it says that where the medical board shall show that the medical records shall be retained. You could add the same section and just say physician records and add it after lines 152.
And then 104 also?
Yes, you could do dental records too, 104 also. Make it consistent.
So Senator Hill, do you want to restate your amendment so we know where we're voting?
Yes. It would be on the first section would be hospital records in their original microfilmed or similarly reproduced form shall be provided upon request to a parent or guardian of an unemancipated minor under 18 without the permission of the unemancipated minor. And Senator Angela Turner Ford has suggested that we make that same language applicable to dental records and physician records in the next two sections of the bill.
Okay, further debate on the amendment? Ready to vote on the amendment? All in favor say aye. Aye. Opposed, no. Appears the ayes have it. Now we're back on the bill.
Move title sufficient, do pass committee sub.
Senator Blackwell.
Thank you, Mr. Chairman. X-rays are by federal law, or you're required to hold those for a minimum of 7 years. And on mammography, a minimum of 10 years to indefinitely. So is this bill changing those federal requirements?
My understanding is you cannot have in this situation, you could not, you could have a bill less restricted than the federal requirements, but it wouldn't affect the federal requirements. In other words, maybe let me try to phrase it this way. If the federal requirement is you retain something for 7 years, Mississippi could require you to retain it for 5 years. If you retained it for fewer than 5, you'd violate both laws. If you retained it for only 6 years and then destroyed it, you would not violate the state law, but you would violate the federal law. And if Mississippi wanted to have a 10-year requirement, then in that case, after 7 years, you would not be violating the federal law, but you would be violating the state law. So I think the federal law could be retaining anything you wanted, and no matter what, you'd have to comply with that. And the state law could be anything, and no matter what, you'd have to comply with that unless the federal law has some sort of preemption language in it, and I doubt that it does, but I don't know. Is that longer answer than you wanted?
Yes, sir.
Yeah.
Why? Why would we put into state law something that is not going to meet the federal law?
I assume that the theory would be that as a matter of state law, we want to retain records for 10 years. It may also be that there is a notion that if there's in the law a number of years that you have to retain something, that more or less gives you permission to discard it after that, sort of in a negative sense, I guess. Senator Ford. I mean, that's the best I can do. It's getting late. All right. Anyone else? I suppose the motion is titled sufficient committee sub. You ready to vote? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2874, the Board of Funeral Service, was that, Senator Turner, was that yours? It was, no wonder I couldn't remember. Senator Johnson.
Apparently I'm very forgettable. Thanks. This bill came at the request of the Funeral Service, Board of Funeral Service, and it simply requests that we add to code that they can do continuing education for funeral directors and embalmers, and it's at a 4 hours per year or eight hours on a biannual time period, and that's an explanation of the bill.
Are there questions, debate? You ready to vote? Senator Johnson moves title sufficient do pass. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. There are two bills that did not work their way to the agenda. Senate Bill 2858 deals with an individual who has got a life-threatening or debilitating illness. Senator Blunt, was that yours?
Thank you, Mr. Chairman. That did come to the subcommittee. You may remember a few years ago, we did pass a right to try law. Senator Harkins filed that 5 or 6 years ago. That law, which has been in effect, dealt exclusively with terminal conditions. The bill before you now also includes severely debilitating illnesses. The intent of the bill is to deal with drugs that have not yet been approved by the FDA for very rare conditions. It can take up to 10 years to get something approved by the FDA. And if you have a disease that only affects a small number of people, you're at the end of the line as far as getting FDA approval. What the bill would do is and we're going to have something to combine this with the existing law for terminal diseases when we get to the floor. But it essentially says that if your physician believes that this can help you and you acknowledge, and there's very specific language in here about consent, that you or someone in your family has a severely debilitating illness and you would like to try this medication that's not yet been FDA approved, you have the right to do that. That's what the bill does, Mr. President. I'll be happy, or Mr. Chairman, excuse me. I'll be happy to yield for any questions.
Questions? Debate? Ready to vote? All the motions title sufficient do pass?
I think Senator Parker had a question, Mr. Chairman.
I'm sorry.
So I just want to relay a kind of a personal anecdote on this because it addresses a biologic individualized for the patient. As many of you know, my wife had a specific test developed for her based upon the tumor markers that were detected at the beginning. That particular test caught a recurrence of her disease early. And I'm happy to say that on Saturday, she was, after treatment, declared no evidence of disease. She will never be remission, but I do understand the intent of this, I believe, Senator Blunt. And I do think that there are tests that come on the market like this that are individualized and developed for patients that can, not only test, but drugs and treatments that can make a difference. And I appreciate the consideration of this bill. So wouldn't you agree, Senator Blunt?
I would agree. I appreciate that story and that good news, Senator Parker.
The motion's title sufficient do pass. All in favor, say aye. All opposed, no. There's one more bill, which is Senate Bill 2860. It is a bill during COVID, there were some situations in which certain medical aids could deliver drugs to people in assisted living facilities. I thought further consideration of this bill might be something we'd want to do. And if the committee thinks well of it, I'd like to pass this out with a reverse repealer just to keep the concept alive until the next deadline. And Senator Wiggins nodded, which I think is an indication he's moving title sufficient do pass committee sub with a reverse repealer. Senate Bill 2860. All in favor, say aye. All opposed, no. The ayes appear to have it. The ayes have it. I just did not get Senate Bill 2732 on the agenda early on. I've already told you I'm an airhead. This is further example of that, but there you have it. And now we need a motion to rise and report. Senator Wiggins, all in favor, rise and report, say aye. Opposed, no. The ayes appear to have it. Thank you.